So it's time for the respiratory side of things with exercise. So there's 4 main challenges that the respiratory system faces, and I have a video for each one of them. And so you need to be able to identify the 4 challenges and then explain how the respiratory system deals with these challenges. This is really important for this exam. Explain. Okay? So that doesn't mean just copy words off slides, but I need you to be able to explain to me what's going on. All right, so the 4 challenges. We've got decreased oxygen and increased CO2 in the venous blood that's coming back to the lungs. We've got increased blood flow, which leads to increased vascular pressure, okay, or pressure inside the vessels, especially in the pulmonary capillaries. We've got increased pulmonary blood flow. This decreases the amount of time that's available for diffusion. And then we've got increased ventilation, which leads to an increased work of breathing. So for this video, we're going to focus on challenge number 1. Low oxygen, high CO2 in the venous blood that's returning to the lung. Okay, we have to protect our alveolar and oxygen and CO2. Okay, so here's our mission. Now I want you to look at this figure for a second. What's happening? Okay, and just to orient you, this is percent VO2 max, so you can think exercise intensity, and this is the pressure of oxygen. Okay, and so we've got alveolar and we've got arterial. So what do you see as we go? What do you see when you with this figure? Okay, notice arterial oxygen remains relatively constant. However, alveolar oxygen actually increases. During exercise, normally, not most people, actually increase the amount of oxygen that's available in their body. Okay, they don't decrease it. And so the question is, and something to think about, and we'll talk about this in a couple weeks, well, why do we stop exercising if I've got lots of oxygen? Okay, so if we go back to earlier in this unit, we talked about the oxyhemoglobin dissociation curve. Okay, well, when we exercise, we have increased carbon dioxide, hydrogen ion, and temperature, and this causes a right shift. This makes it easier for oxygen and hemoglobin to break up so we can take oxygen up into the tissues. Okay, and as a result, we're going to have lower oxygen, arterial or venous oxygen compared to normal. Okay, in other words, we have this condition. So just a quick review of carbon dioxide transport. We convert it to bicarb, we bind it to hemoglobin, and it's dissolved in plasma. Now, when it comes to production, at rest, we normally produce about 200 to 250 mils per minute. Okay, that's about half of a standard 16-ounce water bottle. Okay, but during exercise, we can increase that by up to 30 times. And so now instead of producing a quarter of a liter, which is what 250 mils is, we might be producing 5, 6, 7 liters of CO2 per minute. So 7 liters, that's like 3.5 of the 2-liter bottles that soda comes in. That's quite a bit. Okay, and so we need to protect these gases, oxygen and CO2. Okay, and we've got an equation here. Now, you're never going to use this equation, and you're not going to use this one either. But I want you to take a minute and look at these equations. So let's focus on just the alveolar oxygen one. So what are things that affect it? Well, this is the percentage of oxygen in the atmosphere. Okay, this is the barometric pressure. This is the pressure of water when the air is fully saturated. These things will never change unless you're doing some study. Okay, so these are going to remain constant. All right, and so let's just say that this is 140. All right, what can change are these numbers. So your respiratory exchange ratio, which is just a ratio of how much oxygen you're using compared to how much CO2 you're producing, and then just the actual amount of CO2 in your bloodstream. Okay, so normally let's just say that, and this makes the math a little bit easier. So we're just going to say that this adds up to 150, which it does actually. Okay, and then normal arterial CO2 is 40, and normal RER is 0.8. And we're going to talk more about RER later on in the term. Well, then 40 divided by 0.8 actually equals 50. So 150 minus 50 equals 100. That's typical alveolar oxygen. But what happens to this number is it goes up, okay, during exercise. All right, and so I'm going to erase some stuff here. So we're going to erase this, okay. So our our arterial CO2 might go up to, well, let's just say 50. Okay, let me get my pen back. So we're going to say that this gets up to 50. Okay, we're producing a lot of CO2, and then let's say that our RER is 1. Well, wouldn't you know, 150 minus 50 still equals 100. Okay, now we can mess with these numbers and we can change things, but ultimately what's really interesting is that as we produce more carbon dioxide, okay, we compensate for that. We're able to maintain alveolar oxygen. All right, now let's do the same thing. Let's see, whoops. Okay, so I'm going to erase everything that's on here real quick. So erase all ink. Okay, so now let's look at it with CO2. Now K is a constant. Okay, so you don't have to worry about that. So I'm going to X it out. Well, what do you think happens? So this is amount of CO2 you're producing. VA is the amount of air that's getting to your lungs. This is to your alveoli to undergo gas exchange. This is alveolar ventilation. So what do you think happens to alveolar ventilation as CO2 production increases? It goes up. And generally speaking, it goes up in proportion so that as I produce more CO2, I breathe more to maintain my alveolar oxygen or alveolar CO2 of about 40, right? These are the typical values, give or take. All right. And so we breathe in proportion to the amount of CO2 that we're producing. Now, I want you to look at this figure here, and we've got lots of figures today. But notice what happens to ventilation as we exercise. Okay, and so initially we have an increase, and eventually we plateau regardless of the intensity. Okay, now as intensity increases, the amount that we actually breathe increases, but we'll reach kind of that steady state, or what we call steady state, where you're breathing enough for the activity that you're doing. All right, even at max or heavy exercise, so up here we're going to say this person is about at 110 liters of air per minute. Okay, and they do this by increasing their tidal volume. So this first number is tidal volume, the second number is respiratory rate or frequency. Okay, so they're increasing their tidal volume by a factor of 5. 5 times 1/2 is 2.5. And they're increasing their frequency by just over 4. All right, so going from 12 to 50, you multiply that by 4 and a little bit more, and you get 50. Okay, but even with that, we're still not at our maximum ventilation. There's a test that you can do. I've never done it, but it's called maximal voluntary ventilation. And basically, we put you on a mouthpiece and we say, I want you to breathe as much as you can for, I think it's 30 seconds. Okay, and so it's a crazy hyperventilation. All right, so people are taking big, huge, fast breaths. And in this case, somebody might get above 200 or 250 liters a minute. During exercise, you will never be anywhere near that. So we've still got room to go when it comes to lung capacity. But as I said earlier, we don't have to really worry about it because we're bringing in more than enough oxygen during exercise. And that's even further shown by this figure here. So notice what's happening with alveolar ventilation during this first half. It's increasing, it's pretty linear, but then we get to like this point right here, and ventilation doesn't increase linearly. It actually increases at a higher rate. Okay, so we go from hyperpnea, where I'm breathing enough to meet metabolic demand, or breathing more to meet metabolic demand, to hyperventilation, where now I'm breathing more than what is needed for metabolic demand. Okay, and so initially we're breathing just enough, and this is because my body is adjusting to the amount of CO2, the amount of oxygen, and the pH. And so we think what's going on is that there's signals that we talked about, central command and positive feedback. So at the beginning, your brain knows that you're getting ready to run, so we increase ventilation. And then as you begin exercising, the CO2 in your body changes, and your body makes adjustments. Okay, and so you have this initial increase, and then with the CO2, your body goes, oh, I need a little bit more, I need a little bit less breathing to get CO2 back to where I need it to be. Okay, so we've got a positive and then a negative feedback loop. Okay, and so what you can see here at this, where it says 2.0 for the VCO2, I'm producing 2 liters a minute, is that our arterial CO2 is at 40, our pH is at 7.4, and our PO2 is 90. The same values as what we've got at the beginning. Okay, but then we get into this hyperventilation. Okay, and so as we get to max exercise, our PCO2 drops to 30, our pH also drops, but our PO2 remains constant, might even go up. And so this is exercise hyperventilation. We're breathing more than what's needed for metabolic demand. And that's we determine whether or not someone's hyperventilating by looking at their CO2. CO2's dropped, I'm breathing more than I need. Okay, so what's causing this? Well, the current hypothesis is when you exercise, you're producing lots of hydrogen ion. Remember cellular respiration? We get those hydrogen ions out of the cell, okay? And this causes a metabolic acidosis. And so what we start to do is we start to breathe more because CO2 is an acid. And ultimately what happens is we're having a respiratory compensation because of the increased ventilation for a metabolic acidosis. That's because this is due to the high hydrogen ion. Okay, so high hydrogen ion. Why is this associated with a rise in lactate? Okay, sometimes you'll hear this called the lactate threshold or the ventilatory threshold. Well, what's going on there? Because at the same point that we have right around here, this is where we increase ventilation. It's usually really similar to the same point where lactate starts to increase. Okay. And the hypothesis for this is, well, you get to a point where you can't clear out enough acid. You're trying to, but remember, when we get acid out of the cell, the more acid we get out, the more lactate we get out because those come out together. All right? And so that is how we deal with this first challenge of the respiratory system, or protect the alveolar gases.